My name is Jeff Neer. I work with the UNC Assertive Community Treatment Team. I am a man in long-term recovery from a pretty severe substance use disorder, and this job has been one of the best things that ever happened to me in my entire life. So I have found in my process of recovery that if other people hadn't been open to sharing their experiences with me, my recovery would have been much more difficult. First of all, I'd like to thank people for doing the work that they're doing. I think there's a tremendous need for services in an incredibly large range of need. So I would like to thank people for what they do. I would also like to ask people to remember that our folks come to us a lot of times in pain, in confusion, in difficulties that we can't necessarily relate to or imagine, and remind people to be kind, to be patient, to be open to the fact that we may not understand what's going on. I think it's really easy to get frustrated and impatient with folks when doing this kind of work, and that doesn't help anybody. There are an incredible number of challenges that everyone that's providing services face. There simply aren't enough services out there. Oak City Cares is a great example of coordination of services. I think that's been sorely lacking. I think that I personally struggle sometimes that I'm put in a position of having to grapple and research to find services that are out there that I simply don't know about. Partnerships, I think, are extremely important. And I think we're seeing more of that coordination of care, and I'm very excited about that. One thing that I think is really important from a perspective of substance use and mental health treatment is we also get focused on channels of treatment. I think there needs to be multiple pathways to recovery, multiple types of support, so that people have the opportunity to actually go out and find what works for them. Recovery just doesn't happen. It's a process that takes a long time. From the day I decided I had to stop using, it took me 7 years of concerted effort to actually maintain a period of abstinence over 6 months. And I was putting forth an incredible amount of effort, and I had a ton of advantages that other people don't have. So when we get frustrated with people who aren't doing what we ask them to do, or who show up multiple times seeking help, just keep in mind it is a long-term fight. It is a long-term process, and we need to offer more than one set channel for people to pursue services in. As far as housing resources, I understand that there's an incredible range of challenges there, but we work with individuals with severe and persistent mental health concerns. And, a lot of these folks have a great deal of difficulty meeting expectations in housing, and particularly before they're diagnosed or early in the recovery effort, and then later are punished for that because they may have gotten evictions on the record. And even with, housing vouchers or subsidies, they still can't find housing because they have an eviction on the record. In my opinion, housing is a basic component of recovery from substance use. If you don't have housing, and you don't have food, you don't have a safe place to be, do you really care about what I'm offering you in the form of treatment? You want a roof over your head, you want a meal, and you'll deal with the substance use later. Housing is healthcare. Housing is recovery.